Alright. Hi, my name is Ryan.
Hi Ryan, I'm Tina.
Nice to meet you, Tina. I'm going to be your student physical therapist today.
Okay.
Before we start, I just wanted to let you know that you're not going to be receiving any actual physical therapy interventions today from me or any instructor. This is just an educational experience.
Okay.
Also, just wanted to double check that you're okay that we're recording this. I already had you sign the waiver though.
Yes.
Okay, awesome. All right, and you've already done the oswestry, so that will be uploaded, the oswestry neck disability scale.
Okay.
All right. So today we're going to be taking a look at your thoracic spine. Can you tell me a little bit about what's going on?
I think I hold a lot of tension in it, and
Okay.
there are times whenever it gets very tight and somewhat painful,
Okay.
and I'll get headaches from that. And if I
Okay.
massage it, I can sometimes feel like a knot.
Okay.
And pressing on that knot will relieve the headache.
Okay.
So,
All right.
Yeah.
Headaches usually come on later in the day.
Yeah, generally.
Later in the day, not when you're first waking up.
Mm-mm.
Okay. All right. I'm going to do a basic health history, so I'm just
Okay.
going to ask you a couple questions there. Do you have any heart problems that you have?
No.
Okay. Any hypertension?
Yes.
Okay.
I have hypertension.
Okay. And what's your, do you know your average, like what you usually get as your blood pressure?
Right now, it's fairly controlled right now, although
Okay.
it'll still fluctuate into the 140s over 90s at times, but I'm on medication.
Medication? Okay.
Yeah.
What medication?
Hydrochlorothiazide and lisinopril, both low dose.
All right. Any other medications you're taking for anything?
Let's see, anything relevant?
Mm-hmm.
I mean, not really, no.
Okay.
Yeah.
Have you ever had any falls? Any hit your head on anything? No. Okay. So no head trauma. Surgical history? Any surgeries? Major surgeries you've had?
Like carpal tunnel, nothing
Carpal
major.
tunnel? Okay.
Yeah.
All right. Perfect. Yeah. Any skin disorders you know of? Herpes zoster, anything like that? Okay. Awesome. That's great. Okay. We're gonna just move on. Anything else that I could be missing? Any chronic disease or anything like that? Okay, awesome. All right. We'll move on from there. So talking about your back pain, you said that if you put pressure on it and massage it, it actually goes. The headaches can go away.
Yeah,
so, like,
it affects.
kind of like a tension headache kind of deal.
Yeah.
Okay. Is it? And you said the headaches come on later in the day. Do you notice the like pain in your upper back get worse throughout the day?
Yeah, I mean, definitely the tension does. Yes.
Okay.
I spend a lot of time looking at a computer. So
okay.
Yeah, I think that, and also there are times that the job's stressful.
Sure. Okay. Of course, yeah. So are there any movements that you notice that make the pain worse, make it any better, make that stiffness and pain any better or worse? Not
specifically, although I think yoga helps control it. I do yoga.
Okay, you do yoga, and it usually feels better after that?
Yeah.
Okay, great. Great. Well, it sounds like a good thing to do.
Yeah.
So whenever how about like you're sleeping? Do you sleep on your back?
No, I usually sleep on my side.
You sleep on your side? Okay. All right. And which side do you sleep on? Does it matter?
Mostly my left.
Okay.
Sometimes my right, but.
Does this back pain ever like affect your sleeping?
My neck pain, not really, no.
Yeah, not like the upper back neck pain, no. Okay. All right.
Sometimes shoulder pain will.
Yeah, so you have a little bit of shoulder?
Yeah.
Okay. All right, we'll take a look at that.
Okay.
Can you tell me a little about that shoulder pain just real quick? Just briefly?
Yeah, I mean, it's chronic. It's been for a long, long time. Everything about my right arm is weaker than my left. I think I probably have like a minor tear or something in my rotator cuff, but nothing that's worth surgery.
All right, yeah.
But, I notice it in strength. I notice it in yoga. I notice it when I'm moving things, so. All right.
So, for the purposes of this, because it is educational, we're going to be looking at your thoracic spine.
Yes.
It's upper thoracic. But, so just like that upper thoracic neck area, upper back neck area. But, I'll do like a little short screen on your shoulder and neck just to incorporate all of that. But we're not going to kind of delve into it.
Got it.
All right. Trying to think if I have any other questions. Oh, the scale of 1 to 10. what is this pain in your upper back?
Currently, or when it's real bad?
Let's do currently first.
0.
0. Okay,
Yeah.
good.
Mhm.
And then whenever it's flared up.
The 4 to a 6.
Okay.
I mean, depending on the day, you know.
Okay, 4 to 6. Okay, all right. Okay. Can you tell me a little bit, real quick, before I start, about like your sense of touch? Do you feel that you have any deficits with that?
No.
No?
Like no numbness.
No numbness, tingling.
Nothing.
Any notice like you not feeling anything?
No.
Any rushing up against something? Everything's good.
Everything's good.
Okay.
Mm-hmm.
Good. All right. So I'm gonna start with just a postural assessment. I'm gonna ask you to kind of slide up in your chair a little bit. And would you mind removing your top shirt for me?
Sure.
Okay. If I had a gown, I'd offer it if you wanted it. But we don't have that.
Okay.
Okay. And actually, just before we get started, I'm gonna take your heart rate. I would do your blood pressure. We don't have a blood pressure cuff right
Okay.
here. So let me get my watch set up. Okay. All right, 20, so 80. All right.
Okay.
That's all right. Cool. All right. So I'm just going to do a little bit of postural assessment like I was saying.
Mm-hmm.
Just bear with me as I take a look at how you're sitting. Good. Good. Yeah. And I can notice like this shoulder is sitting a bit higher than the left shoulder.
Mm-hmm.
All right. Pretty straight spine, no curves noticeable, just sitting here. And no excessive lordosis or kyphosis. A little bit of rounded shoulders, that comes with the probably sitting in that kind of forward. Yeah, sure. Okay, I'm gonna have you stand up for me.
Mm-hmm.
Now, I know you mentioned to me that before that you're ticklish, so I'm gonna, this is the only thing I'm gonna have to deal with this. You might want to put your hands onto my hands.
Mm-hmm.
I'm just going to check your hip levels here, okay?
Okay, yep.
So if you want to, you can do that right
Okay.
now.
Yes.
Yeah? Cool.
Mm-hmm.
And just move them up a little higher for me. Good.
Mm-hmm.
Good. Hip levels look good. Down here. PSIS. Good. All right, those are all normal. And can you slowly just bend forward for me and like slide your hands down your legs. This is the Adams forward flexion test. It's a special test, usually for scoliosis. You don't have any signs of scoliosis, but we're just checking. So if you had a lump on either side of the curve, but you don't have a curve. All right, and just come up nice and slow. All right, great. So you can sit in the chair again.
Mm-hmm.
And as I said, I'm going to do a little bit of a screen.
Okay.
So we'll do like a nice quick screen. So first, can you bend your head forward and touch your chin to your chest? Good. And relax. Okay. And now can you look at the ceiling as far back as you can? Good. And relax. Can you touch your right ear to your right shoulder? And without bringing your shoulder up too much. There you go. Good. And your left side. Okay. All right. And now can you rotate your head to the side? Good. As far as you can, and then the other side. Good. And one more time for that. Yeah. And the other side. Yeah, so you get a little bit more motion looking to the right, which makes sense if this is all tight up here.
Mm-hmm.
Okay.
Mm-hmm.
And also probably a little bit. Could you do the shoulder again real quick? And just and then now the other way. Yeah, you get a little bit more going that way too without movement. Okay. All I want you to, I'm gonna apply a little pressure. I don't want you to let me move you, okay? All right. So hold, good. Same thing. Hold here, good. All right. Good. Good. Any pain with that? Or any of this? All right. Same thing. I'm gonna try to turn your head. Don't let me. Good, and relax. Same thing other way. And relax. Good. Any pain with that? Okay, good. All right, so can you raise both of your arms over your head for me? Good. Your range of motion is good. That yoga is working. This is it's good though, because I was expecting you to have more of a loss in this, and you only got probably might be 5 degrees behind if anything. But you've got really good range of motion. This is normal. So, and can you bring them down?
Yeah.
All right, and then just bring your arms up to here for me. Good. And don't let me move you, okay? Hold. Any pain with that?
No.
Okay. Can you bring your arms out to the side? And all the way up above your head? Good. Yeah, the same thing. I don't see anything. If anything, actually, this one might be a little bit, you might have more range in that, in abduction, which is interesting. Okay, and then back out to the side. Good. And just don't let me move you, okay? Hold. This one hurts on this side. Okay.
Yeah.
All right. That's something to make note of for sure. Any pain whenever you lower from this position?
No.
Okay. All right. Can you bring your arm